When a child is critically ill, the environment can feel like pure chaos. Every single second matters. But here's the thing. Underneath all that urgency, there's a powerful, systematic approach that brings order to the entire situation. We're going to walk through that exact framework.
So imagine you're faced with a sick child. The situation is tense, right? Alarms might be going off, parents are of course worried sick. Where in the world do you even start? It's a question that can feel totally overwhelming, but the answer is actually surprisingly simple, and it starts from a distance. Believe it or not, before you use a single piece of equipment, before you even touch the patient, the most critical part of the assessment has already begun. It's what we call a hands-off evaluation, a super fast observation that basically sets the course for everything that comes next. And this initial glance isn't just random. It's formalized in a tool called the Pediatric Assessment Triangle, or PAT for short. And this is not some long, drawn-out exam. It's a structured observation you can knock out in under 30 seconds to get a really good general impression of how the child is doing.
The triangle is built on three really key observations. The first side is appearance. Just how is the child acting? Are they listless? Are they agitated? An abnormal appearance can point to a problem with the brain. The second side is their work of breathing. Are they struggling, making weird sounds? This obviously points towards a respiratory problem. And the third side is circulation, which you check by looking at their skin color. If they're pale or have a blotchy, mottled look, that could signal an issue with their blood flow.
So, in just a few seconds, the PAT doesn't give you a specific diagnosis. That's not its job. Instead, what it gives you is direction. It helps you categorize the problem. Is this looking neurological, respiratory, or circulatory? And that guides your immediate focus to where it's needed most. Okay, so with that initial impression from across the room, it's time to get hands-on. We've identified the likely area of concern, and now we need to get in there and confirm it with a real physical assessment. And the roadmap for this hands-on part is the classic ABCDE approach. This is a universal, systematic method for evaluating and managing the most immediate life-threatening problems. Let's walk through what each of these letters means. We start with the absolute essentials for life: airway and breathing. First things first, is the airway open and clear? Because if it's not, literally nothing else matters. Once we know it is, we move straight to evaluating how well the child is actually breathing. And assessing breathing is so much more than just counting breaths. Sure, we look at the rate, but we're also looking at the effort. Are they using extra muscles in their neck or chest to breathe? We listen to their chest for air entry and any abnormal sounds, and we'll use a pulse oximeter to check their oxygen saturation. Each piece of the puzzle gives us a clearer picture.
Okay, let's move to C, circulation. This is all about perfusion. Basically, is oxygenated blood getting to all the tissues in the body? When this system fails, it leads to a really critical state that we call shock.
To put it simply, shock is when the circulatory system just can't keep up with the body's metabolic demands. It's like a profound energy crisis happening at the cellular level, and it is absolutely life-threatening if it's not recognized and treated fast. So to assess for shock, we use these 5 key checks. We're looking at heart rate, the quality of their pulses, and how fast color returns to the skin after you press on it. That's capillary refill. We also check their skin temperature, and of course, their blood pressure. But, and this is a big but, blood pressure can be really deceiving in kids. And that brings us to a super important distinction. In what's called compensated shock, the child's body is working overtime, firing on all cylinders to keep the blood pressure normal, even though their tissues aren't getting enough oxygen. By the time you get to hypotensive shock, the blood pressure has finally dropped, which means the body's coping mechanisms have failed. Recognizing shock before that blood pressure drops is absolutely key. All right, we've stabilized the airway, breathing, and circulation. Now we can move on to the final 2 steps of this primary survey: disability and exposure. D for disability is just a quick neurological check. We're assessing their level of consciousness, checking how their pupils react to light, and this is so critical, we're getting a blood sugar reading right at the bedside. A low blood sugar, hypoglycemia, can look just like a serious neurological problem, but it's often incredibly easy to fix. And finally, E is for exposure. This means carefully and respectfully examining the child's entire body. The goal here is simple: find what you might have missed. Is there hidden bleeding, an injury you couldn't see, or maybe a telltale rash that could be the key to the whole diagnosis? All while making sure, of course, to keep the child warm. So the whole ABCDE approach helps us find and fix the immediate threats to life. But once the child is stable, our work isn't done, not even close. Now we have to figure out the why. We've treated the symptoms right in front of us, but that critical question still hangs in the air. What is the underlying cause of all this? To answer that, we have to move from the primary assessment to the secondary assessment. The heart of the secondary assessment is gathering a focused history, and we use another helpful mnemonic for this: sample. This structure just ensures we ask about all the key stuff, from the child's symptoms and allergies to the specific events that led up to this emergency.
And that's really the fundamental difference you have to remember. The primary ABCDE assessment is all about finding and fixing what will harm the child right now. The secondary sample assessment, along with a full head-to-toe exam, is all about discovering the underlying disease process, the root cause.
Of course, this whole clinical assessment doesn't happen in a vacuum. This is where diagnostic tests come in. Everything from a simple blood sugar check to more advanced imaging, they're all used to confirm the suspicions that pop up during that hands-on evaluation.
You know, when it's all said and done, the PAT and the ABCDE approach are so much more than just a rigid checklist. They really form a dynamic mental model, a system for thinking that allows someone to step into a chaotic scene and systematically create clarity, focus, and life-saving action.
And that kind of leaves us with a final thought, doesn't it? This method of breaking down a complex, high-stakes problem into these manageable steps, that initial glance, then a structured, hands-on survey, it's just incredibly powerful. It really makes you wonder, what other chaotic situations in life could benefit from a similar, systematic approach?